Prinhanda Akrioso. Good afternoon and welcome to Public Health Network Cymru's second webinar for 2021. My name is Christian Heathcote-Elliott and I am Principal Public Health Practitioner for the wider Determinants of Health Unit and Manager of the network. Today's webinar focuses on working with sanctuary seekers to identify assets and co-produce solutions. Populations such as asylum seekers and refugees have been particularly vulnerable to the wider harms from COVID-19. And as we move towards recovery out of the pandemic, harnessing community assets and working with specific populations to understand their needs will become increasingly important to mitigate against widening health inequalities. I'm therefore really pleased to welcome our speakers, Stephanie Kays and Kerry Mellow. Stephanie works for Public Health Wales as a community development researcher, and prior to joining Public Health Wales, she worked in a number of organisations to improve the provision and information and service delivery for asylum seekers and refugees in South Wales. Kerry is head of business at TyPorb, a third sector organisation that promotes equality and social justice in housing in Wales. Before joining TyPorb, Kerry was Director of Dimensions in Wales, a not-for-profit support provider for people with learning disabilities. And in her previous roles have included being senior housing positions with Cardiff Council and with a range of housing associations in South Wales. After Kerry and Stephanie's presentation, you will have an opportunity to ask your questions. Please be aware that these questions that you put in the chat box will be seen by all our webinar attendees today. Now, just a couple of housekeeping points. During the webinar, if we could ask you just to switch off your cameras and put your microphones on mute. This webinar is being recorded and will be made available on the Public Health Network Cymru's website after the session. English and Welsh subtitles are available, and these can be switched on Microsoft Teams using the button on the top right of your screens. If you do experience any difficulties with the technology during the webinar, please let us know through the question and answer box. So I'm now going to hand you to Stephanie and Kerry, and I hope you enjoy the webinar.
Good afternoon, everybody. Thank you so much for joining us. Thank you, Christian, for that introduction, and thank you for Public Health Network Cymru for giving us the platform to be able to share with you what we have been doing. So like Christian said, my name is Stephanie, and I've had the privilege to work on the Community Assets, Participation and Integration, Taking Action Locally project, in short, Capital. And it's been an amazing journey. I've met individuals in that community who are tenacious, who are willing to work and make relationships with other people that they don't have connections with, to change their community and their local area, and to improve things for their children and future generations. This project is funded by the Health Foundation, and it's funded under their Taking Action on the Social Determinants of Health program. The Capital project worked to address social contributors of poor health and well-being, such as loneliness and isolation, by helping communities to build relationships and strengthen community connections, such as social bonds, social bridges, social links that are collectively known as social capital. Social capital is an important wider determinant of health, which supports better well-being and health. The project worked in partnership with TyPorb, as Christian mentioned, and it's an organization that promotes social justice and equality in housing in Wales. And I'll give over to Kerry now to explain a little bit more of the work that they do and how they were involved in the Capital project.
Thanks, Stephanie, and it's great to be here today as well. So TyPorb means Housing for All, and we are a third sector organisation focusing on equality, diversity and social justice in housing. We have nearly 70 members. All of the housing associations in Wales are members of TyPorb. We have local authority members, supported housing organisations and community-focused organisations. We provide training and support and guidance to the housing sector. We represent their voices to Welsh Government, and we run campaigns focusing on improving housing access and standards. We pride ourselves in working in partnership with a wide range of organisations, whether that's carrying out research for them, running focus groups, developing specialised training, or doing research or developing toolkits. Our partnership with Public Health Wales has been a particularly rewarding one, and I'm really happy to be here today with Stephanie at this event to share our learning with you. Thank you. Next slide.
Yeah. Thank you for that, Kerry. If we can have the next slide, please. So the Capital Project focused on bringing people together, people from different backgrounds who would usually not interact or connect with each other. And in particularly, the Capital Project worked with asylum seekers and refugees, which are known as sanctuary seekers, and people who live in social housing. We invited them to take part in an asset-based community development project in Morriston, Swansea. This area was chosen as the location of the project after examining a range of factors, including levels of different types of housing, existing community development activities, and looking at the Wales Index of Multiple Deprivation. Morriston is an electoral ward in Swansea and is the largest ward in the county and city of Swansea. Most of the residents in Morriston are born in Wales, but it's also an area where asylum seekers are dispersed by the Home Office and where refugees and other people born outside the UK settle. The project aimed to facilitate integration and building stronger relationships on an individual, but also on a community level. Because evidence has showed us that most settled communities and migrants are exclusively disconnected or separated because of different misconceptions, whether it's culture or religion or just the level of understanding that people have about immigration or Home Office policies. But the strongest evidence that we found was in connection with housing. There's a perceived competition with housing where maybe people have an understanding that certain migrants have more chance of getting social housing than other people that are maybe on the waiting list. So these misconceptions make people too reluctant to build relationships, even when they live in the same locality. So the Capital Project tried to bring people together to build those relationships. So for people who are not really familiar with sanctuary seekers, it's a term that's used to describe asylum seekers and refugees. Both of those names are really people who belong in the same groups, because it's people who've left their country in seeking sanctuary. So maybe because of war, or they are being persecuted and have come to the UK to seek for safety. But the difference is when you are acknowledged as a refugee, you've gone through the asylum process, and so the Home Office has officially acknowledged you as a refugee. But and when you become a refugee, obviously you have the status, and you can work and you can claim benefits and such. But the asylum process itself can be lengthy. And the outcome is really uncertain, because you don't know if the Home Office is going to accept the asylum case, and if you're going to be granted refugee status. So coupled with being housed anywhere really under the Home Office dispersal system, in Wales we have 4 dispersal cities. So it's Cardiff, Swansea, Wrexham, and Newport. So asylum seekers can be sent to any of those 4 places in any area in those places. It's a non-choice based system. So having left home and family, experienced trauma, and not being allowed to work, and all those restrictions that the Home Office places on people who are seeking asylum, and then coming into a new place and being lonely and isolated and not maybe having connections and unfamiliar with how things work and how services work, can really cause anxiety and stress and depression. So taking all those factors into consideration, and also being lonely and isolated, can really have detrimental effects on people's health and well-being. And on the other hand, social tenants have some similar challenges as well. They might be moved, they might have to move maybe to a new area where they can find accommodation because in the area where their family and friends are, you know, maybe housing is not available there, or their circumstances have changed. Maybe the family has become bigger, or somebody has become disabled, and they're not able to be given accommodation in the area that they want to live. So those factors, you know, coupled with other wider determinants of health, maybe such as the area where they live, you know, things like crime or antisocial behavior or unemployment, or just maybe the level of income that they have. Those type of things can really affect people's health and well-being. So Capital really worked to foster relationships and promote integration, because we realize that when people realize their full potential, and it makes it easier for them to access services, it reduces educational and health inequalities that we've seen with COVID-19, it helps them to find job, and fundamentally, it underpins social cohesion and community empowerment. Also, the one thing that we found when we did our research, the evidence that we found was both sanctuary seekers and people who live in social housing are painted as passive recipients of welfare. Their resources and capacity for self-care and resilience are rarely acknowledged, and generally are not engaged in decision-making or the development of their own community. So Capital gave the participants in this community an opportunity to realize and showcase and use and develop their assets, they were engaged in decision-making and development of their community. They were able to show service providers and policymakers that communities have the ability and the capabilities to improve their own communities if they are given an opportunity. Not recognizing and realizing the assets of different elements of a community risk entrenching higher levels of isolation and weaker social networks, negatively impacting on integration, on relationship building, community cohesion, and consequently affecting people's health and well-being. And Capital worked to build those networks, to build those relationships, to improve health and well-being. I'll give over to Kerry now to continue. If we can have the next slide, please.
Thanks, Stephanie. So yes, as Stephanie has touched upon, quite often when we're looking at communities, it's very much a deficit approach, kind of what they haven't got, what they can't do. And we wanted to have a different approach, a much more positive approach, hopefully. So we held asset mapping workshops with the local community, and Stephanie held those in those heady days when we were able to meet together physically in rooms, and hopefully those will return soon. And from that, we identified there were a smaller group of people within that larger community who said, yes, we're up for working with you and seeing where this goes, which I guess showed a certain amount of bravery for starters, really. So when I say we were looking at the community assets, what we're actually talking about. So in a nutshell, we were looking at the skills and the capacity and the knowledge of the people in that community. And we were looking at them as the experts for their communities because they lived there, they knew their community best. We were also looking at the social capital. So that's looking at the networks and the connections within a community, which perhaps aren't formal, they're not necessarily kind of written down in some way, and it includes things like friendships and neighbourliness, and can also include some of the more kind of informal help and support that groups of people give each other in a local community. We were also looking to capture what local groups and voluntary groups were already working in that community. So, you know, that's as wide as it's long, really. So you're thinking of things like Neighbourhood Watch, Brownies, Keep Morriston Tidy, any kind of group like that, really, mapping those. And then moving on to kind of what resources were available in terms of public sector, private and third sector. So were there, you know, local agencies working in the area that we could also map. And then lastly, but not, I guess not least, were the actual physical assets of the community. So the buildings, so the libraries, the community centres, that kind of thing. And what you can see on the slide is a poster that the group put together. And it basically captures the skills, the talent and the knowledge of the Capital Group. We Love Morriston Group. And I mean, I guess you can say it's a pretty amazing list there. There's a huge variety of things on there. But I think it's worth mentioning that it took us several sessions of working together before the individuals in the group felt confident to talk about, to share and to, I guess, value what their gifts and skills and talents were. So some of the things that we did just to try and help strengthen that really, we started, and we still do actually, started each session by sharing something positive. So that meant that everybody in the group shared something that they were happy to share that had happened in the previous week or month that was positive. So that could be something as simple as I got my washing machine fixed so I could do my washing, to an old friend rang me and we had a great conversation. And what was nice to see was as the time went by, if someone was struggling to think of something positive, because let's be honest, we can't always be positive all of the time, then other people in the group would kind of chip in and remind them of something or just kind of give them support, which was really great to see, really. Another thing that we did was that, again, at the early meetings, when we were meeting actually together in a room, we chose a different theme where we could kind of share a story about. So we did things like we shared what's the meaning of my name? And then people could share as much or as little as they wanted around that. So they could just share the meaning of it, or they could share, as well as that, kind of why their parents chose that name for them. Another thing we did around St David's Day last year was talking about what we love about Wales. And again, it just kind of gave the group another way of talking. It meant that everyone had a say at the beginning of a meeting, so that, you know, nobody hadn't kind of opened their mouth and said something. And it gave each person a better understanding of where other people in the group were from, and, you know, perhaps, you know, kind of what their lives had been in the past. Another thing we did was we had large-scale maps of Morriston dotted around the room, and they were focused on different things. So one of the maps was about kind of where people lived. So people just went up and put a sticker on the street where they lived, and that meant that people then could see how close or far away they were from other people in the group in the neighbourhood. One of the other maps was about green spaces. So people there used their local knowledge and marked the local parks, places which were nice to walk. And the third map was around the kind of physical assets, so where the library was, Citizens Advice Bureau, job centre, things like that. And we kept putting those maps up every week, because every week people came in and said, I've got something else to add to the map. And that was interesting, because people were kind of going out and looking and almost researching their community, really, and then coming back quite excited and sharing what they'd found out. And it meant not only that they had learned something, but obviously they were sharing that with the group, so the group had learned something as well. And the last thing we did, which I'll mention, is everyone had created their own one-page profile. And a one-page profile is kind of what it says, really. It is one page which you can use to share what you want to share with other people about yourself. And one of the first things on there is something called what people like and admire about me. And that means that you have to go out and talk to your friends and family and ask them, what do you like and admire about me? Which, let's be honest, I don't think many of us do very often. But what you get back is just a load of positivity, because that's what you're asking, a positive question. You have to have a positive answer. So if you ever want to feel warm and fuzzy, then I recommend you ask your friends and family, what do you like and admire about me? And again, the group were coming back each week, adding to their one-page profile, sharing what their friends and family had said about them. And that again was interesting, because sometimes their friends and family were valuing things in that person that they hadn't necessarily valued themselves, or hadn't even thought that they had as an asset. So again, that was a really kind of positive experience, really. And I should just mention that this part of the work, we were also supported with by the Co-Production Network for Wales, who helped us to work as co-productively as we possibly could during this whole process. And I'll now pass back to Stephanie, and the next slide, please.
Oh, thank you, Kerry. So like Kerry mentioned, with the asset mapping workshops, really, and kind of like collecting all that information, gave people an opportunity to acknowledge the assets that they had. Because sometimes when people haven't maybe been in work for a while, or like people who are asylum seekers who are not allowed to work, sometimes you can forget the skills that you have and the knowledge that you have. So it was just really a great way for people to be reminded that they are skilled, that they are worthy, you know. I remember when we did one of the asset mapping workshops at a mom and toddler group, and one of the ladies said, I don't have any skills. She actually said, I am rubbish. I can't do anything at all. And I looked at her, and she was the one kind of like recording the names of the mums that were coming and the children. She was collecting the money for the teas and coffees and biscuits, you know, and she was buying it and then recording that. And I said, you know, those are skills that you have. That's recording, that's organization, you know. And after I said that, you know, she said, yeah, that is so true, you know. So the asset mapping workshops were really a great way for people to also acknowledge their skills, but also for us to put them in that poster that's on the screen that Kerry was just on the slide that Kerry was on. It's a great way for us to highlight the good things that are in that community, because most of the time when you talk to communities, it's always about problems. Oh, there's dog poo and there's this and there's that, and people forget about the positive aspects of their community. Obviously, it's important to talk about, you know, the challenges that are there, and that's why out of the asset mapping workshops, the action group was created, the one that Kerry was talking about, and how they came together. So the action group came together, but even in those sessions, it was a great reminder for them about the skills and how they could apply them to build their own community-led project, obviously using the asset-based community development approach. But in that, while they were working together and all the things they were doing, like Kerry mentioned before, they were building relationships, they were getting to know each other. And most of the time, they found out that even though they were from different backgrounds, they actually had some similar experiences, some things that they enjoyed that were similar. So they came together and they started working on the project. But also it gave them an opportunity to kind of like look at the things, the challenges that were in their community, things that they can respond to, things that they can identify to maybe build their project on. And also the one thing that we did at the beginning of the project was including the local councillors in that area, introducing the project to them, explaining what we were trying to do, so they knew that that was happening. So at the end, at the last slide, I'll speak more about all the learning that we've done, that we're going to share that with policymakers and decision makers. But there was also a session where one of the participants actually invited one of the local councillors to come and meet the group, and the group had then an opportunity to talk to him and ask questions and ask for assistance. And he actually did take away some tasks that he went away and he came back with feedback. So that was really good. So giving the group opportunities to create those social links, as part of social capital. But also, like I said before, it was a great way for us to promote the assets of the community. And now that the project is coming to an end, the capital project is coming to an end in March, so next month, it's kind of like, all the work that the group has done over the last 21, 22 months, we are highlighting that. Even with this presentation, is us highlighting what has happened, what has the work done, the approach that we have taken on capital, co-producing with the community, giving them the power to be able to make decisions and be involved in the operation and organization of of the project. You know, those are the things that we can share, and that's why we are on this platform today, is so we can share and people can go away and use the tools that maybe we are sharing if they are involved in the same work or are trying to do the same thing that we've done on Capital. So I'll give over to Kerry again.
Next slide, please. So on the slide, you can see these are the three highest priorities that the group came up with. But I have to stress, this is a short list. The long list was a lot longer. We wanted the group to identify what the most important shared issues were for them in the community. And again, because they were the experts, they lived in Morriston. So over a couple of sessions, they discussed what they liked and what they didn't like about Morriston. They then grouped them into themes and discussed what they'd found out about the community assets that would relate to those themes and their own kind of gifts and skills, assets that they could bring to those issues as well. Then the group had 3 votes. So we had the long list up on several flip charts on the wall, and everyone in the group had 3 stickers which represented 3 votes, and they chose where they put those stickers in terms of the issues. So if they thought something was so important it had to have all 3 of their votes, they would put 3 of their stickers against it, or they could share them across 3 issues or whatever. And we then had pretty much 3 clear winners, which you can see there on the screen. And these were the things that the group decided they wanted to focus on for the next sort of stage of their work. So that was around creating a newsletter, establishing ESOL classes to improve the English language skills, and also introducing some new activity groups as well. So if we kind of follow those across, so the original issue, the top one, was insufficient community activities locally. And part of the concern that they raised was that they had to travel into the city centre to access activity classes, which was expensive. But what they found out when they did some research and looked at their community in a bit more detail was actually there were quite a lot of activities locally, but there was a lack of information about what those activities were and how you could access them. So the idea they came up with as part of that was to create a newsletter which could then share information about activities, and they could share that then with the local area. Similarly for the ESOL classes, again, the main issue there was that they had to travel into the centre to access them. But then again, by doing some research and sharing what their gifts and skills were, they discovered that there were quite a few people in the group, including one who had been an English teacher, or a foreign language teacher, who could potentially assist with putting on more local ESOL classes. So that was the idea that the group came up with for that one. And then the last one was sort of connected to the activities idea, but they had ideas about new and different activities that they'd like to see in the community that weren't currently available. But again, they looked at their assets within the group and the fact that they were passionate and wanted to do something positive, and decided that they wanted to establish some new activities that could kind of complement the ones that were already in existence, and actually lead on doing those classes themselves, because they had the gifts and the talents to be able to do that. So then, of course, we hit lockdown, and so far the thing that the group has focused on has been the newsletter, and they've done really well with that. So I think 7 newsletters have been produced. I'm sure Stephanie will correct me if I'm wrong, it might be 8, and kind of seen a real kind of positive development there. So the first 2 or 3 certainly had some assistance from Tai Pawb and also from Public Health Wales, but increasingly the group have taken full control and responsibility for producing the newsletter. So they've always had editorial control, but now they've developed the confidence to put it all together, and the sort of more technical aspects, I suppose, really. So that's really, really positive. The other thing I want to mention before we leave this slide is the other kind of element of the project was participatory budgeting, which is not always the easiest thing to say, so I like to shorten it to PB. So what is PB? Well, PB started as an idea in Brazil, and basically it's about giving citizens and people a chance to decide how public money is spent in a far more taking control way, I guess, than just voting in your local democratic elections. And what it meant in Brazil was that very excluded and poor communities actually had a far greater say in saying what was a priority for them and what was important. And as a result, the money has been spent in ways that have actually benefited those communities far more. In the UK, there's some examples of PB. So certainly in Scotland, London, and I think in RCT, there have been some small local examples. But the general learning from the whole participatory budgeting experience is that it increases people's self-confidence. It improves their kind of knowledge about what's going on in the local community and their understanding of other kind of needs within their communities, and it's also increased people's interest in volunteering as well. So the amount of money that we had for this group as part of the grant funding was £2,500. So far during lockdown, the spend has been pretty minimal because there's very little to spend money on, really. So one thing we have done is the group decided would be a good idea was to purchase some SIM cards for some members of the group who were finding it difficult to afford the data they needed in order to access the meetings online, and also to do some of the research, etc. as well. But moving forward, the group are talking very positively about what they'd like to spend the money on. So some of the ideas they've come up with so far are using some of it to resource the activity classes when they are able to be started and running. And they're also looking into something called friendly benches. So I won't go into friendly benches here. If you Google friendly benches, you'll find lots of information about it. And it really ties in with some of the other issues they had, which aren't on the shortlist, but were around kind of isolation and wanting to engage with groups of the community that perhaps are isolated and lonely. And I'm going to hand it back to Stephanie. No, I'm not. It's me again. Next slide, please. Can I have the next slide, please? Is it Casper? Can you move to the next slide, please? Thank you. Thanks. So I've already mentioned co-production and that we were aiming to work to co-productive principles. So I just wanted to touch on some of the kind of examples, I guess, of that. So although the project as it's funded is called Capital, the group wanted to have their own name. So they came up with We Love Morriston after much debate, not only on the name, but also on the logo and the marketing and the branding. So they use their WhatsApp group to share those ideas in between the virtual meetings, and also to have a vote on the sort of final. I think they came up with a sort of top 6 of the logo, and then the group voted to decide which one was their favourite. So that's the one on the screen that you can see. I've mentioned WhatsApp as a communication channel, and we set that up before lockdown, but I think it's been invaluable, really. And I think the things for me that it's really helped with is some members of the group have, for different reasons, not been able to engage regularly in the weekly meetings, but it's meant they've always been kept informed about what's happening, because the notes from those weekly meetings are posted on the WhatsApp group by one of the group members. And there are conversations and discussions that go on during the week about different decisions and different information as well. So I think that's one of the positives for me, is that, you know, sometimes people don't come to a group meeting for a couple of weeks or months, and then they perhaps feel awkward about going back to it. But because of the WhatsApp group, and the fact that we're virtual anyway, people can have a presence without actually always being present, if that makes sense. They also have their own Twitter handle and are using Zoom for the meetings, which after a little bit of a shaky start has actually generally worked really well. Stephanie's already touched on the sort of local stakeholders that have been involved. So the Morrison Regeneration Forum, one of the group members actually went to the forum and spoke about the group and spoke about some ideas that they had and had a positive reception. Morrison Rotary Club actually came to one of the virtual meetings and talked about what they did, and the group talked with them about kind of what overlaps there might be and where they might be able to do some sort of shared work together. The two local primary schools have been really positive. Some of the group members, their children go to those schools. They had already volunteered one of their community rooms before the lockdown that the group could use for meetings in the future, and also possibly to run some of their activity classes in the future, and had also suggested they might be able to distribute the hard copies of the newsletters when they were producing hard copies through, you know, to the parents as well, which would be fantastic. I've mentioned how many newsletters. Oh, I was right, it was 7, and the group are actually now registered as members of the Swansea Council for Voluntary Services, which means that they now have access to free advice and support from that service, as well as free training as well, which is really great. Okay, next slide, please. So throughout the whole time that we've worked with the group, there have been one-to-one interviews with them at the beginning of the start of the project, in the middle, and towards the end as well. So we've been able to kind of track various indicators in terms of how they're feeling about in themselves, and about how they're feeling in terms of working with the group. And I'm not going to read out all of those things that you see there on the screen. I'm sure you can read them for yourself, but I'll just pick out a couple of, or expand on a couple of them. So certainly, I think increased closeness. They now pretty much, they have used that they see themselves almost as a family. In terms of how they, you know, interact with each other, work with each other. There's certainly been some friendships created from, you know, within the group between certain individuals, and they also are definitely far more aware of what's going on in their local community, and how they can get connected to it as well, which is really great. Confidence levels, you can see that in the group, just in terms of, you know, how they've just really grown as the project has grown, and I'm sure Stephanie will expand on that in her next slide. But, you know, they're reporting a real kind of sense of achievement about taking part and what they've been able to do so far. And in terms of the group meetings now, which are still happening weekly, so just to say briefly that we had a break in April. The group decided there was going to be a break while the whole lockdown kind of kicked in, and people were just kind of getting their heads around it. And then from May last year onwards, the group has met weekly, and I think probably less than 3 times in that time when there hasn't been a meeting, you know, which I think is pretty amazing, really, in the current kind of climate. And you know, you see them now, and they're setting the agendas, they're sharing the actions. They've taken on the formal roles for groups, so there's a chair and there's a secretary, and it's probably taken a little bit longer to get to this point than it would have done because everything is virtual, but they have got there despite everything, and that makes them very proud. Next slide, please.
Okay, well, thank you, Kerry. About the things that we've learned as an organization working on the capital project, we've learned some valuable lessons as an organization, But it has also reaffirmed that the practice that we chose to apply in the work on this project has been the right decisions. We have created a roadmap to inclusive co-production. It was actually a toolkit in the beginning, but then it changed to a roadmap of inclusive co-production that we hope to share next month, that gives an outline on the steps to take when engaging with communities that are kind of like, quote unquote, I'll put it in inverted commas, excluded and overlooked. So we're working on that, and we're hoping to share that next month. And it just includes the steps and what you should include at every stage. The work that we've done on capital, I have to say, aligns really well with the Welsh Government's Healthier Wales, its plan for health and social care and public bodies implementation of the well-being goals, as stated in the Wellbeing for Future Generations Act 2015 Wales. Particularly a healthier Wales, a Wales of cohesive communities, communities that come together and build together, a more equal Wales and a resilient Wales. I think one of the things that I've really learned from this project personally is that communities are resilient. They have the capacity. They want to do things for their communities. They are passionate, and like Kerry said in the previous slide, they've really taken on this role and they are working on it and they're passionate about it. But briefly, here are some of the things that we have learned. We've learned that language is really important. So the words that we use matter, because some words are potentially stigmatizing, it can be disempowering, because one of the participants, like Kerry mentioned, that we were kind of like recording data as we went along in the project. You know, when we were kind of like doing the last bit of questionnaires, the participants, one of them actually described it really well. She said it was like an ID that you've been given and you can't go, you know, above that ID. It's almost like you're blocked into four walls. That ID makes you as such. And although you have the capabilities and you want to do something, it's almost like you are hampered by the ID. So it's really important that we use and maybe consult communities as to how they want to be addressed in the first place. We've learned that you have to really use clear, jargon-free language. I think it's as service providers, we like to use jargon a lot that nobody understands anyway. Sometimes I don't understand it myself, because it's just really, we need to make clear, you know, what we're hoping to achieve, why we want the community to be involved, consult with communities on ideas. I know when we went in with capital, we already had kind of like an agenda on what we were trying to do. But once we got there, you know, we kind of like really gave it to the community to decide and direct and redirect as how they wanted it to go. Even just things like where they wanted to meet. They chose the community space in Morriston before lockdown where they wanted to meet. They chose the day, they chose the time, because it's about them. It's no use us saying come on a Tuesday at 2 o'clock if people have other commitments. So it's really, really important to consult with communities. We have to be inclusive from the start. But one of the things that we've learned as well is how we interpret or define community, because community for different people means different things. And what we've seen with lockdown is that community, the definition of community has changed for people. People define their community as what connects them or what could connect them. And sometimes a postcode can really limit the sense of community, because how people define their community may be different as to how we or policymakers define it. Technology, as we've seen with COVID, that connects people may render postcode meaningless marker for community if the ties are not shared. So we really just have to be careful with that. It is also important to note that people with shared experience sometimes may not have shared backgrounds, or they might not have relationships. And that's why we wanted to cover the whole 3 elements of social capital. So it wasn't just building social bridges, different people who don't have the same backgrounds, but it was also bringing people together who maybe have the same backgrounds and live in the same community, but don't have those connections. In many respects, people seeking sanctuary, asylum seekers and refugees, and people who live in social housing, and just people who live in a community, maybe worlds apart, but they might have shared experiences with each other. We found that in the sessions that we were doing, that people had so much in common, although they were from different backgrounds or different educational levels or whatever, but they had some certain things that they shared. You know, some of the things were maybe parents with, you know, little young children, and a park was really important for them. And although maybe one mom was a sanctuary seeker and the other mom was a social housing tenant, you know, that was really important for them, that their children had a, you know, a playground, you know, or an activity that they can go to. But also it's also important that we kind of like look at the barriers that keep people away from engaging, and, you know, really help people with that, whether it's childcare or reimbursing bus fares, or in our situation with COVID, where we had to make provision for data packs so people can join the Zoom meetings and be able to engage through WhatsApp, you know, things like that. And especially when you work with asylum seekers, because they get £37.75 a week. If they have to use a bus ticket and have to wait a week for it to be reimbursed, or, you know, you only have a system where you do bank transfers. Asylum seekers don't have bank accounts. They're not allowed to have bank accounts, or the systems just don't allow them to have that. So you have to put things into place and kind of like look at things that can help people to engage if you want people to be part of what you're doing. But also what we learned was that it's really important. We started off kind of like thinking, okay, in co-production, or if this is going to be an asset-based community development approach, that we have to relinquish all our powers as organizations. But it's not really about relinquishing total power. It's working together so everybody brings something to the table. Because we work in organizations where there are some structures and some, you know, some boundaries that we have to work in, and we just have to make that clear at the beginning that, you know, we can do this, but, you know, there's certain things that we can't do. So how do we work around that? What ways can we work around that? So like I said in the beginning, you know, communication and being inclusive from the very beginning, so everybody knows where they stand. You know, you don't want to do the work and then people, you know, communities later say, oh, but you didn't say that, or I thought it was going to be this. We have to be really clear. And also it's really important, especially with co-production, that, you know, we promote ownership, especially when it's people coming together to create a community-led project, which means it's their project, that we have to kind of like give them the ownership from the beginning. Like I said, you know, having them make the decisions about the times and days and the ideas for the project, what they want to address, how they want to go about it, how they want to spend the money, because it creates conditions of a sustainable project, and avoiding the sense of abandonment. Because like I said, capital project is ending at the end of March, but we had to work from the beginning to put those things into place, you know, and to let the community know this will come to an end. Our official support will come to an end, and prepare them for that. You know, like Kerry said on the previous slide, you know, like their membership with the SCVS, to get that support, connecting them with the Morriston Regeneration Group or the Friends of Morriston Park or the Rotary Club, you know, so at least even when Public Health Wales and Type Help are no longer involved, that they already have formed those connections and they can go forward and you know, keep the project going. Because one of the things that we found out when we were doing the asset mapping workshops was people were really a bit reluctant, because they said, oh, projects come and go because of funding, you know, it's there for 2.5 years or 3 years and then we are left by ourselves, you know, so what's the use of engaging anyway? So people need to know, you know, even though funding is ending, that there's something that's continuing, because if they are linked in with other organizations and groups that can support them, you know, they won't feel abandoned or alone. So like I said, we are working on our roadmap. We'll share that widely as soon as it's finished. We're working on our evaluation report. We'll share that as well. I'm going to ask Casper now we have a short video actually that the community, the We Love Morriston project made, just talking about their experiences and how they feel and how they got involved. So Casper, if you can play the video for us, please.
Shwmai a croeso. Hi and welcome to We Love Morriston. What if people all come together from different parts of the world in order to help enlighten and empower the village of Treforest, that is Morriston. We Love Morriston is a community of volunteers and goodly people wishing to make differences for the local residents, no matter where they are from.
My name is Lizan. I am Kurdish from Iraq.
My name is Beatrice from Lansamblet.
My name is Auder Ahmed. I am a Kurdish asylum seeker from Iraq.
When we came here, we don't know anyone and we don't have any friend, anyone in the city. So we decided to make a new friend and to be part of the community. We start volunteering job. And through this idea, when we find this project, we decided to be a member and to use our skill to making Morriston better place for live, even not for us, for our kids and for next generation also.
I am so glad I joined We Love Morriston project. It's been a really great journey.
We start involving in this project when we need to contribute with the community in the world and be integrated with the people here to make a new relation, make a new friend. This is the beginning. The most important things is that the project don't have idea needed to do. They just want to listen to the community and what's their need. Based on that, they decide the outline of the project. The idea changes because we need to find an idea to be easy, to be matched with the new situation that we have been with the lockdown. We got the idea to the newsletter. As we live in Morriston for a long time, always I hear there is some activity there, here, but I don't know. I don't have idea about that. So we say let we collect all the activities that happened in Morriston and to be in one page paper, to be easy to read. Everyone can take advantage of the activities that happen here and also bringing people together as much as we can.
I personally have learned a lot of new skills. You know, I'm learning, I'm improving my confidence. I'm learning to build strong relationships.
To get this chance to contribute to enriching the locality is special. By coming together as one, we can and will make differences to the young and old. I am honoured to be part of this cooperative community of like-minded sharers and carers for the betterment of the whole community of Morriston.
The positive impact has been, you know, just to see the faces of people who are willing to bring a change in the community. I think that's what the world needs.
So this is our journey, and I am very happy to be part of this, and I am proud as well.
I find that the We Love Morriston project is better Morriston.
We Love Morriston project is this: love, peace, unity.
We Love Morriston is bringing people together, contribution in the community, and sharing love.
We Love Morriston is here. We are live. Hey, be good, be kind, and step forward.
Thank you, Stephanie and Kerry. That's a really insightful presentation. Really enjoyed that, and it was really heartening to hear you mention about that you thought right at the beginning of the project around thinking about the sustainability and life after the project ended, because you know, I think it's often an issue with some of these small scale projects, isn't it? They have a life when they've got momentum, but afterwards is more difficult to sustain. Just a quick question from me, I guess, and just was around just thinking about when you did the project, and of course the COVID, the pandemic came in between the project, and I just wondered your sort of observations around any potential challenges that the COVID has brought for this particular population group.
Should I go, Kerry? I think one of the challenges, some of the challenges that we experienced kind of like right at the beginning is like everybody else, you know, people's focus changed. You know, if your children, they were home, you know, there were people who were really worried about their health, you know, and were shielding. So some of those challenges were really regarding kind of like just changing in the changed environment. And it, like Kerry said before, you know, the group took a break in April to just kind of like reassess and see how they will fit in and how they're able to contribute. But one of the good things, like Kerry said, was really the WhatsApp group has worked wonders, because even when people were unable to participate, you know, fully, they were still on the WhatsApp group. They could still see what's going on. And that was really encouraging. And if they needed help, you know, they'll ask for help on the WhatsApp group, you know, because I use my work mobile. I'll switch it off at 5 o'clock. And then, you know, the next day when I switch it on, people have been chatting all night about different things, just really encouraging. So although there were challenges in the beginning, I think the WhatsApp group has worked really well. And I'm really glad to say that that was put in place before the pandemic. It's almost like we knew it was coming.
Yeah, really good that with the technologies enabled that communication to continue.
Do you want to add anything, Kerry?
The only thing I'd add probably is that because some of the people in the group had families abroad, I guess there was an added worry for them because you know, obviously the situation in different countries was different, you know, and the resources available in different countries was different. So they had those kind of added worries and concerns that, you know, they shared with the group, and they got support from the group as well.
Yeah, thank you. We've had a question from the audience about how did you, when you started this project, how did you explain to the local authority what you were trying to do, and how did you frame that?
Oh, you're frozen, Christian.
Oh dear.
I can hear you
yes.
though. Can you just repeat the question, please?
Sorry, yeah, so the question was, how did you explain to the local authority, so Swansea, about what you were trying to do, and how did you frame that? That was the question. Yeah, so what we did was kind of like really invite. We looked at who we could kind of like really invite, who could have like interest in the project. So like I mentioned, you know, like the local councillors, but there were also kind of like cabinet ministers, you know, like for health or for communities or for housing that we wanted to introduce the project for. But what we did was just really explain, you know, like just how I explained during the presentation, how it's funded, what we were trying to do, and essentially what learning we could share. I think for the decision makers or the local authority, for us was more about the learning that we would share with them. So if they are going to engage with communities, because obviously local authority has a broad spectrum of engaging with communities, and if they're going to engage with communities, kind of like sharing what we did and how it worked, the lessons that we've learned, maybe things to avoid, things to do, and kind of like just really acknowledging those overlooked or excluded communities, for them to be included in decision making, to be consulted when, you know, if an area is being developed or an activity is being developed in a community, you know, I think it's really imperative that we consult that community, you know, because what we might think is important for them might not be. And I like this quote that I don't know, I think Nelson Mandela used it, but I think it comes from somebody else.
something for us without us is not for us, something like that, you know. So if you're doing something for a community and you're not involving them, you're not consulting them, how do you know what they want? And sometimes that's how it is, where we come up with a service we want to provide to a community, nobody takes it up. Just because, you know, it's not what they need. People have different needs and other commitments. So I think what we really want to share is that consultation is important. Being included in decision making is important for communities, regardless if they live in social housing, regardless if they are sanctuary seekers, because those are the labels really that make people be excluded and be looked at as just, you know, they're just there, we'll just do it for them and they just have to go along. I think it's really important that we move away from that type of system. I think if anything, the one thing that we can learn is how COVID-19 has brought to light the inequalities that exist in our communities, whether it's, you know, regarding health or education, or, you know, the level of housing or type of housing that we give people. You know, I think those things, because everything else really, like housing or education or income, you know, those things impact health inequalities, it impact the wider social determinants of health, you know. So it's just not one thing. And I think the Well-being and Future Generation Acts, you really kind of like highlights that we have to work together, and it's just not service providers and stakeholders working together, it's working together with communities. And I think that's why co-production is so important.
Yeah, thank you. And I think certainly, you know, our reflection on the recovery from COVID will be the importance on really harnessing community assets as we work towards moving out of the pandemic. That's great. Well, that's all we've got time for today. And thank you ever so much for your presentations, really insightful. And just one quick final question from me is that in terms of the roadmap, would you be okay to share that with us, and we would be able to put it on our Public Health Network Cymru website?
Yes, definitely. we want to share it as widely as we can, because we think it's a great piece of work, and it's not just something that Public Health Wales or Type Help have come up with. It's all the feedback that we've gotten from the participants and our own observations.
Great, thank you very much. As I say, thank you once again for a really insightful and enjoyable presentation. We're grateful for everyone who joined us today. If they could complete a short evaluation, a link was put in the chat box, but we'll also email you afterwards. And if you're not a member already of the Public Health Network Cymru, please do join us. We have a lot of webinars. And finally, if you have any thoughts for future webinars, then please do let us know. But thank you very much for your presentation. Diolch yn fawr. Thank you.
Thank you.
Thank you.